they just did right after it's wet,
It
it
burns.
stings real bad. So, the other thing is if you go in and you don't see a flash and you have to redirect, when you go in like this,
Good thought, let me.
do not, so when you go in, you're in and you don't see a flash. Your needle is gonna be in. You're not just gonna start moving around like this.
Don't go fishing.
So when your needle's
Yeah.
in, you wanna draw it back to where it's just under the skin. So it's just under the top layer here.
Sure, since I'm in the right position. Okay, so what we're saying is, bevel,
Bevel up.
so
Bevel's always up. by
you
the way.
go in and you don't feel, hang on. And maybe you got a flash, maybe it disappeared, or you just didn't get anything. This is it. Withdraw just till and you kind of have to guess it, till the needle is right above the skin. And then if you're feeling a pulse more here or here, redirect. So if I feel a better pulse right there, then I'm gonna redirect and go straight in. What you don't want to do is, you're in this, is very hard to puncture.
Come back just a little farther. It'll be easier, I think, to move around. There you go.
Okay, what you don't wanna do, and I have seen, is redirect this way.
See how that needle is bending?
Because guess what you're doing?
You're just
That
knocking
last
it out
time
of
I
the way.
got blood drawn, they did that on me.
Oh,
and it
yeah.
felt awesome.
So withdraw, and then go back in. And always look for that flash.
And if you see it, stop.
And if you see it, stop. Now,
Hold
if
your
you
breath.
see it and then it disappears, maybe you went straight through the artery, back out.
So typically when starting out, I tell you guys to go nice and slow, because if you go too fast, like she said, you may just go right through it. So just go nice and slow. And a lot of the times I won't take the needle from you. I will just tell you, where do you feel it? I may feel behind you, and if I feel it this way, I'll actually tell you with the syringe, now I want you to take the end of the plunger and I want you to direct it towards the door after you've pulled it back a little bit. Direct it this way. So it's not just going like that. It's almost like you're going like a joystick.
Don't pull on the plunger.
Yeah, you're not pulling, you're just moving it. So if I want the needle to go that way, I'm not just gonna go like this. You're gonna actually come, so it's like a joystick. And it's all about feel. You can't see it, so it's all about feel. But I don't wanna take the needle from you, I want you to feel it. Now notice, some of the places you're at, the patient either needs to be completely asleep or they're wide awake. So there's nothing worse than your first time.
Who's that
Like this.
Kettering? Yeah, Kettering is, your patient has to be very comatose or unconscious in order to draw. But I don't believe there's any
At the
stipulations.
valley, you don't.
That sounds good to me.
So-
Yeah, Allie, our instructor.
But-
Are
was,
you
like,
sure
telling
they're
us
not
just
going-
sitting there
But the good thing is, it gets that kind of fear out if they are awake. So it's kind of, meh. So
One other thing I thought of, so everybody has their method. So I did, you feel for the pulse, and I'm glad Brian brought this up. Sometimes you're gonna feel for the pulse, then you're gonna alcohol it, but when, on the site, but then also alcohol your finger that you're gonna feel the pulse with again, because you just cleaned off the site and then you're gonna contaminate it again with your glove, because you've been touching stuff, right? So this is my technique. I feel for the pulse. Sometimes I actually close my eyes to feel for the pulse. And then I literally memorize it, move my finger and go like this, or just barely move it and go in. Some individuals will take their hand completely away.
I go in front. Some people go in between.
Yeah, some people do this because you're kind of visualizing.
Oh.
I'm not a fan of this technique
Mm-hmm.
because you can actually stick yourself this way more than anything else. But just know that you're going to see some different techniques and you'll develop your own.
And for us and this is, I learned this actually just by doing it. So people with bigger hands, when I'm feeling here, my fingers are gonna cover a lot. So say the artery's right here, but because of the size of my fingers, it may feel like it's here. So over the last couple of years, I've learned to use the tips of my fingers. So I actually feel like this instead of like that. So it's almost more of a direct, exactly where you're gonna feel it. So.
Much more narrowing it down.
Mhm.
Never ever, I have seen this.
Mhm. I have to.
First of all, I'll never forget the nurse drawing that and the first time you kind of going, what are you doing? I've always done it this way. And I said, well, the blood flows this way. So chances are if you go against it with the bevel up, it's gonna fill up pretty quickly.
Yeah.
So 45-degree angle, bevel up this way, not go with the blood flow, go against it. Anything else?
We were told also at HM, like we were watching a second year do it, and she pulled out the needle, and then she had to go get a brand new kit. Is that correct?
Yes.
So when you
If
pull it all
you
the way
if
out.
you completely
Yes.
move out, have I seen someone go right back in with the same needle? Yes, but right there is increased risk of contamination. Go get a new needle, sterile needle, and start all over. So yes, that's correct.
Generally, I take like 2 kits with me just in case. You're not gonna
Ward
need
off
it.
evil spirits.
You're not gonna need
Yeah.
it, but
For purposes of the checkoff, what we're looking for is the technique. And same in the hospital. So once you're checked off here, so get in here and practice, start practicing. So once you're checked off here, then you can go ahead and start doing that in the hospital setting.
It's crazy.
So seriously, this is that one where you just don't, I mean, you can get a med nab wherever. ABGs tend to be a little bit challenging, so please do that. But the reality is if you don't get the blood, that does not mean you didn't pass the checkoff. We're looking for the technique, making sure you cover all your pre, during, and post. That will come. Go Cobra Kai.
And when is this checkoff?
When is this checkoff? 2
it-
weeks from today? Or
2 or
3?
3. I think 3 weeks.
Three.
'Cause
Is
2
it the
weeks-
same
2
as
weeks
the PD&P
No.
or is it after?
After.
No.
So you got 3 in a row.
Boom, boom, boom. Now, I said this last year, if you are, and last year was kind of a different ballgame, right smack in the middle of COVID, but if any of you are, there is time during lab and you would like to do this ahead of time, so you have more time to practice clinically, feel free to do that.
Like check off early? Is that what
Yeah.
you're saying?
Yeah, I don't have a problem with someone. Now, again, it depends on the availability of the instructor and all that kind of stuff.
Right.
But as you can see, we do have a little bit of time left over. If you're done practicing and want to do that, it's completely up to you. You don't need any of us